Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Prime Minister Narendra Modi says economy is returning back on track of normalization after 2 weeks of first phase of nationwide unlock. COVID testing capacity ramped up to 3 lakh tests per day. Recovery rate reaches 52.46% in the country. COVID-19 recovery rate in Nagaland records 56%. And NPCC asks state government to keep its decision of regularization in abeyance. Prime Minister Narendra Modi has affirmed that the economy is returning back on track of normalization after 2 weeks of the first phase of nationwide unlock. In his opening remarks during his interaction with the chief ministers of 21 states and union territories through video conference, Modi said that the views and experiences of all states and union territories will be discussed to strategize future roadmap of nations' fight against the global pandemic. He affirmed that a preemptive and proactive response of the government placed the country in a better position to address the COVID challenge. He highlighted the timely decisions taken by the government, an early preparedness approach which helped the country to chalk out measures to save many lives. He said when India's fight against COVID-19 will be analyzed in future, this time will be remembered for how the centre and states worked together in fighting the pandemic. He said it served as an example of cooperative federalism. He said in the last weeks, thousands of Indians returned to India from abroad and hundreds of migrant workers reached their hometowns. The Prime Minister said that even a single loss of life due to COVID is saddening and the nation should not lower its guard even during the unlock. He urged every citizen to strictly follow all necessary precautions, including wearing masks, maintaining do gaj ki dur, meaning a distance of 2 yards, and washing hands regularly with soap. The Union government today said that the COVID-19 recovery rate has reached 52.46% in the country and a total of 1,80,013 people affected with coronavirus have been cured in the country. During the last 24 hours, 10,215 people have recovered from this infection. Presently, the total number of active corona cases in the country is 1,53,178. Meanwhile, the Indian Council of Medical Research (ICMR) said that a total of 1,54,935 tests of coronavirus were conducted by the various laboratories in the country within the last 24 hours. So far, 59,21,069 tests have been conducted. As of now, total 907 laboratories across India have been given approval to conduct a test for COVID-19, including 659 government laboratories and 248 private laboratory chains. The COVID-19 recovery in Nagaland has reached to 56% after 8 more patients were tested negative. The state has now registered a total of 100 patients being recovered from the infection. Presently, the total number of confirmed positive cases in the state stands at 179, with 2 new cases of COVID-19 being reported today. With this, the state has now 79 active cases, which are all asymptomatic cases. Health Minister S. Pangyapom tweeted this morning that 2 from Kohima Quarantine Centre were tested positive out of the 316 samples tested. Meanwhile, the district-wise status on COVID-19 positive indicates that Dimapur has the highest number of 126 cases, followed by 31 in Kohima, 9 in Mon, 8 in Peren, and 5 in Trensa. The centre has asked states and union territories to proactively engage with the private healthcare providers to facilitate enhanced bed availability and critical healthcare facilities. The Health Ministry said that states have also been asked to ensure fair and transparent charges for the services being provided. Some states like Tamil Nadu, Odisha, Maharashtra, Gujarat, Uttar Pradesh, Rajasthan, Telangana, Karnataka and Madhya Pradesh have already taken the initiative. A special train from Delhi ferrying stranded citizens of Nagaland reached Dimapur this afternoon. The train carrying about 580 persons from Nagaland arrived at Dimapur railway station around 12:20 p.m. The returnees of Dimapur, numbering 211, were shifted to Agri Expo site, 4th mile, for undergoing mandatory protocols. The remaining returnees from 10 districts were screened by the medical team at railway station and sent off to their respective home districts. This news comes to you from All India Radio, Kohima. Nagaland Pradesh Congress Committee (NPCC) has lamented that a fiasco created by a cabinet decision in a medical department during this time of pandemic is uncalled for, saying that regularization should not be at all a priority. In a press release, NPCC President K. Terrier termed that a failure to arrive at an understanding between the state government, NHM, Employees Association, NEAN, and the demand of Nagaland Junior Doctors Association, NJDA, as disturbing, saying that the need of the hour is for maximum service output for medical fraternity. He said this is a time that all must work together with the spirit of sacrifice. Terrier also opined that the state government should have avoided such an erratic decision at a time when the state is faced with a pandemic. He further pointed out that the decision of the government has violated the spirit of fundamental rights of equal opportunity. Terrier suggested the government to keep its decision in abeyance and talk with NEAN and NJDA to uphold the values of constitutional provisions of equal opportunity. The NPCC president appealed to striking employees to call off their cease work to save lives. Army today said that one of its officers and 2 soldiers were martyred in Ladakh's Galwan Valley on Monday night during a violent face-off with the Chinese army. In an official statement, Army said, during the de-escalation process underway in the Galwan Valley, both sides suffered casualties. Army said senior military officials of the 2 sides are currently meeting at a venue to defuse the situation. Defence Minister Rajnath Singh has reviewed the situation at a meeting with External Affairs Minister Dr. S. Jaishankar, Chief of Defence Staff General Bipin Rawat, and the 3 service chiefs. Later, Defence Minister Rajnath Singh briefed Prime Minister Narendra Modi on the issue. Centre has refuted a claim that the central government has postponed the wage hike of the employees until next year. Press Information Bureau today said the DOPT's order is related to completion and deadline extension of annual performance appraisal report (APA) of the employees and not related to increment. It said wrong details have been explained in the report. Few media reports claimed that the central government postponed the wage hike until next year. The Committee on Petition of the Nagaland Legislative Assembly, NLA, in its introductory meeting held on 2nd of this month, has decided that individuals, associations or institutions desirous to file petitions relating to redressal of public grievances may send their petitions to the Office of the Secretary, Nagaland Legislative Assembly. The petition should be in English or Nagamese, duly signed by the petitioner or petitioners with date and countersigned by an NLA member, and addressed to the Commissioner, Secretary, Nagaland Legislative Assembly. It informed that the petitions may be related to a bill which has been published under Rule 64 or introduced in the House, any matter connected with business bending before the House, and any matter of general public interest. The committee further said that any anonymous petitions raising individual grievances or trivial matters are liable to be rejected immediately. The Committee on Petition, which was constituted on 15 February this year under the chairmanship of MLA Dr. Chamben Muri, including committee members, will function for a period of 1 year. And now it's when the news, here are main points again. Prime Minister Narendra Modi says economy is returning back on track of normalization after 2 weeks of first phase of nationwide unlock. COVID testing capacity ramped up to 3 lakh tests per day. Recovery rate reaches 52.46% in the country. COVID-19 recovery rate in Nagaland records 56%. And NPCC asks state government to keep its decision of regularization in abeyance. That is all we have in this evening news bulletin. Good night.